This is a story of how the NHS broke my jaw and then gaslit me into thinking it was all in my head and there was nothing wrong. Before we get into this story, I just want to say this is not about saying the NHS is bad, but that when you are stressed, underfunded, you can make mistakes. And that if you as a person know that there is something wrong with your body and a doctor is disagreeing with you, ask for a second opinion if you truly feel something is wrong, because doctors can make mistakes and they can't know everything about medicine. Okay, let's get into the story. Make sure you've got a cup of tea or a drink because this is a long one. So this originally starts when my daughter got chickenpox and passed it on to me. Now, I'd never had it before. It was the first time I ever caught it. And pretty much within 2 days, I went from being absolutely fine to extremely unwell. It started with a high fever, body aches, loss of appetite. And when I was walking around, I felt like my head was so dizzy, I was about to pass out. Then after 4 days on the Friday, it got so severe, my temperature with paracetamol in my system was staying at 39. I physically was unable to keep myself awake. When I was standing up, I was passing out. My body was screaming at me that there was something very, very, very wrong. And it was sending alarm bells off in my head. I had one little spot on my finger, one little spot on my belly, and that had been the same case for 4 days. So I was like, is this really chickenpox? I don't know what's going on. Now, I do have a history of contracting tonsillitis quite severely to the point where I get hospitalised, which is not fun, but it does mean that I need a lot of IV antibiotics and pain medications to actually be able to swallow. So on that Friday, I did the right thing. I spoke to the pharmacist. The pharmacist was like, nope, you need to go to the GP. So I booked a GP appointment and they said, yes, you do have chickenpox, but you have also contracted other infections and we don't know how many and we don't know where these bacterial infections are. It looks like you're starting to get bacterial tonsillitis, but your temperature is extremely high. She was concerned about my heart rate and my blood pressure was on the floor. It was so low and she was very, very worried. And she said to me there and then gave me antibiotics. If my temperature gets any higher, or if I can't control it, or if I get even the slightest bit worse, I needed to go to the hospital. So I come home, my temperature at this point is nearly at 40, it's like 39.8. I take some paracetamol and I go to sleep. I wake up a few hours later, paracetamol's out of my system in the most unbearable pain I have felt. And I have given birth twice. It felt like my blood was had knives in it through my system. My skin hurt. It hurt to breathe. It felt like my brain was confused. It was horrible. I took my temperature and it was 39.8. So I took 2 paracetamol. It was the time to take it. There had been enough time between doses. And I watched over the next hour as my temperature didn't go down, but started to increase. When it got to 40.1, that's when I realised something is very, very wrong because paracetamol is supposed to bring your temperature down. I called 111, who immediately sent an ambulance to my house. Now, we're in Birmingham in the UK. The NHS is spread very thin at the minute, and to get an ambulance sent to your house in a few minutes is extremely rare. It is reserved for those cases where someone is very, very unwell. And that ambulance turned up 2 minutes after the call to 111 had finished. Alhamdulillah, was amazing. When the ambulance came, they were trying to help me. I felt like I couldn't talk. I nearly passed out a few times. They were worried about my heart rate, about my blood pressure, about my temperature, everything. So they decided to take me to the hospital. Now, as I said, I was struggling to walk at this point. So they were helping me down the stairs in my house, trying to get me into the ambulance bed, at which point my temperature had started to go down. Directly we got back in the ambulance, my temperature skyrocketed up to 40, which I was wearing a short sleeve top, tracksuit bottoms, I didn't even have any socks on. There was no physical reason for my body to be that hot other than an infection. Now, when we got to the hospital, I was on the ambulance bed. And if you've never seen an ambulance bed, they have these black sort of pole things sticking out at the end of them. And, after I was checked in, I was moved to a private room because I was heavily contagious with chickenpox. They didn't want me to pass it along to anyone else because it's so infectious. So they took me from the ambulance bed and put me into the bed in the room. Now, when they told me to transfer at this point, I am high on gas and air. If you've ever had gas and air, you are on cloud 9. Your body doesn't register the pain you're in. I was up there with the rainbows and the clouds. I was not on earth anymore. So they tell me, oh, you need to move over. Now, I've already told them I have a history of POTS, my blood pressure is low, and I feel very, very dizzy and have nearly passed out quite a few times, and walking is incredibly hard. So they go, it's okay, you'll be fine. So I go, all right, and I trust them as medical providers. At this point, I sit up, everything goes black, and I fall backwards. And I hit this side of my face, the right side of my face, when my jaw is hard, full body weight onto the black corner of the bed, and a bit of like a thing that was sticking out of the wall. And it hurt. But the thing is, I was in so much pain from my tonsils, my skin. I could feel my blood at this point. I had gas and air still in my system, that the pain didn't fully register. And the paramedic turned around to me and went, oh, don't do that, you'll hurt yourself. And I was like, oh, okay. We're not, okay, that's fine. We're not going to be concerned about it. So if you're not concerned, I'm not going to be concerned. You know, stayed in the hospital for a few days. And this is important to know, because I've already got distrust for this specific hospital, because during that stay, at one point my temperature skyrocketed again. When they did my observations, they saw that. I was like, can I have some medicine to help it go down? And they said sure, and just never came back. Half an hour later, I was in so much pain again. I literally felt like I couldn't keep my eyes open. And this sense of like peace came over me. I was like, I feel like I'm being called to the netherworld. You know what I mean? That I'm going back to God at this point. So I pressed the little buzzer to call the staff and was like, hey, like, you know, something's wrong. No one answered that call. And instead, I heard people walking past my room going, oh, I don't want to help her. That's the girl with the chickenpox. She's infectious. I'm not going in there. Not by one member of staff, but by multiple members of staff. These are people that are supposed to be taking a job as a healthcare provider to look after you, to care for you in one of your most vulnerable moments. And I was there curled up in the fetal position on this bed, hearing these members of staff questioning, was actually someone going to come and help me, or was I going to die? To the point where an hour passed nearly, and I was sat there trying to recite the Shahada, because if you're a Muslim and you recite the Shahada when you're dying, you're supposed to do that. That is how unwell I felt. And I am not a hypochondriac. Like, I'm the type of person that, you know, I probably should have gone straight to A&E with a temperature of 40.1, but I'm going to call 111 just in case, just to make sure, because I don't want to cause a fuss. Eventually someone comes and she freaks. The nurse freaks when she sees my temperature. She runs out. She's telling doctors, no, get the medicine now. No, you're not going to do something else. You're getting the medicine now. Alhamdulillah, she was amazing. Again, when I was then transferred to the ward, stood up, passed out, blacked out. Great. So definite history of blacking out there. At this point, my jaw is still hurting. At this point as well, I've got like chickenpox that looks infected, because they've had to give me ibuprofen, and ibuprofen is known to cause skin infections in chickenpox, which is why you're not supposed to give it when someone's got chickenpox, right? So I can see very clearly, red rash, hot to touch, spreading over my body. Great. I tell multiple doctors over and over again, hey, I think this might be infected. Would you mind taking a look? And multiple doctors confirm, yes, it is an infection, and don't do anything about it. When I then get discharged from Heartlands, they say to me, yeah, we're going to discharge you. We'll give you the antibiotics for your tonsils, because I got tonsillitis again. At this point, I had multiple bacterial infections in my body, plus a viral infection, plus chickenpox. So that was, at one point, I had like 6 infections swimming around in my body. So they give me antibiotics for the tonsillitis, loads of other medication to be taking, but they don't give me any antibiotics for the skin infection. When I'm released from hospital, I don't get any better at all. I am still worse, to the point where my temperature is still quite high. I still can't keep myself awake. And that's when I call my GP again and go, hey, I just want to check, these antibiotics that they gave me, are they treating tonsillitis and a skin infection? He goes, no. And I show him my finger. I show him like where like the chickenpox are infection. He goes, yeah, you need a secondary antibiotic. And it was only then when I chased it up to say like, I don't think I've been prescribed them correctly, that he was like, no, you haven't. And was like, yeah, you need these extra antibiotics. And it was only then when I started to get better. Now, 2 weeks after that, finally off of all of the pain medication. This entire time, my jaw is killing me. It is so sore, but I'm constantly on pain medication, so it's helping it a little bit, like very, very strong pain medication. I stop all of that, and the jaw pain gets so much worse, because obviously there's no pain medication to help it or make it better at this point. I'm still, like, I go back to eating and drinking normally, my tonsils are healed, and my jaw is so sore to the point where it's swollen. to touch it, it hurts. I can't sleep on that side. Like, if I open my mouth too wide, like, the pain, I get shooting pain up my ear, down my neck, all of this. I'm, like, in agony at this point. And then it starts to get worse. I'm like, do you know what? Maybe I've sprained something, whatever. It will heal within a few weeks. Like, there's no way I've broken something. It's just a sprain. I don't need to do anything with this because it will heal. I don't need to waste a doctor's time. So I experienced this for 2 more weeks. 2 more weeks I'm in pain and it is not getting better. It gets worse to the point where when I'm opening my jaw too wide, it feels like tastes like there's blood in my mouth. And it's not all over my mouth. Like, the first time it happened, I freaked out and was like putting tissue in my mouth trying to figure out where the blood was coming from. But there was no blood. I could literally taste on this side of my mouth blood, nowhere else. And it was really weird. Like, there was no cut or anything. And that's when I contact my GP and I'm like, hey, this is happening and I don't know why it's happening. And I remember, I hit my jaw when I was in the hospital. I don't know if that's got anything to do with it, but it's been 4 weeks now and it's really quite sore. And the GP goes, oh yeah, you need to go to the hospital. Like, it's possible you've broken it. And this is where things get even worse. And it's the same hospital I go back to. You know, I see a first doctor and she's lovely. I explain the situation and she's like, yeah, that's not okay, the way they treated you or anything that they did. They should have checked your jaw, like, when the issue first happened, all of this. And she sends me for a scan. Now, when they go to the x-ray, I go in and obviously they'd requested a special x-ray for me to get the whole picture around my face. Everyone who was there before me got seen. Everyone who came with me got seen, and then even people who had come in after me was also getting seen. And now I know A&E, it works on a priority basis, but one, I needed the toilet, so I was like, I don't want to go to the toilet and my name be called, but also I was like, have I been checked in properly? Like, is everything okay? So I asked the lady at reception, she's like, oh yeah, has no one spoken to you? I was like, no. She goes, yeah, you've had a special x-ray request. They don't know how to do your x-ray, so they're learning. So I'm sat in the waiting room while the radiologist is learning how to do the x-ray. Not a student, an actual qualified radiologist learning how to do the x-ray. And I'm like, okay, that's fine. That's reassuring. I was like, that's okay. And then I sit back down and I wait again and I eventually get seen. And you can see the guys looking at the x-ray machine. Like, when he looks, like, he does a scan, he's sort of looking at it and you can tell he's got no idea what he's looking at. He's really unsure. He's like, he's got no idea. Takes me for another normal x-ray as well. This is like over an hour. I then get called back, and obviously at this point they've been prodding and poking my mouth. Like, I am in agony. Like, I'm in so much pain at this point. I'm like, I need to take some pain medicine. I go back into A&E. Someone, not really nice nurse, gives me some medicine. And then all of a sudden a different doctor calls me in. And the second she looks at me with utter contempt and disgust in her face. And I'm like, oh, this is going to be fun. And she pulls me into one of these, I don't know, consultation rooms, which has already got another patient in it. And there's just this like curtain pulled through. And I'm like, okay, you know, understaffed, it's fine, you know, underfunded. You need to cut back on space, it's cool. Sit down on this like blue bed. There's no tissue on it. And I'm just like, I pray this is clean because I don't want to leave here with a bigger infection or anything than what I came in with. And she goes, so tell me what happened. So I say, well, 4 weeks ago. And she goes, no, I mean tonight. And I'm like, sorry, yeah. Like, when she said no, she was like, oh, no, I mean tonight. Like, she was quite rude about it. And I was like, sorry, no, I do mean, like, this is what happened. It started 4 weeks ago. It's pertinent to the story. And she goes, oh, okay then. I explain, like, hey, brought into hospital in A&E, was transferred from bed to bed. When being transferred, fell and hit my face. Been in pain ever since. Really weird, can taste blood in my mouth, don't know why. Doctor said to come to hospital. And she's like, yeah, well, there's nothing wrong with you. I was like, what? What do you mean there's nothing wrong with me? She's like, yeah, your scan's clear, there's nothing wrong with you. And I was like, I'm sorry, you're telling me that there's nothing wrong whatsoever? Because at this point, my jaw is swollen. If you look at me head on, you can visibly see that my jaw is swollen. Like, it hurts to touch. I'm like, what do you mean there's nothing wrong? Like, I'm completely normal and fine. She goes, yeah, there's nothing wrong with you. I was like, at this point, I'm like, have I been imagining it? Am I like psychosomatically having symptoms? And she goes, yeah, there's nothing wrong. There's nothing on your scan. So I was like, well, what about the taste of blood in my mouth? Like, what about the fact that if I open my mouth too wide, I get the taste of blood on this side of my mouth? She goes, yeah, well, that's impossible. That can't happen. Your scan is clear. There's nothing wrong with you. It's impossible to taste that. without having a cut in your mouth. And I went, so you're telling me that you think that I'm imagining my symptoms, that they're not real? And she's like, well, I can't tell you what you're feeling, but your scan's clear. There's nothing wrong with you. Like, with the most attitude in her voice. You could tell she was looking at me like I was a piece of rubbish or poo under her shoe. I was just like, at this one, I'm getting like really upset because I'm like, I want to cry. I'm like, am I imagining this? Like, what the heck? Like, knowing I've been so mistreated before when I stayed in this hospital, I was forgotten about. They didn't give me the right, there wasn't bedding properly in the room, the ward that I was staying in. There was no pillows, there was nothing. Like, knowing that I was forgotten about, I had a nurse give me drop a cup on the floor and then give it to me for me to drink from. And I'm like, this is the same hospital that's telling me I'm imagining this. And I was like, I want to see another doctor. I want to see another doctor because my body is telling me something is very wrong. There's no way, because if it's a sprain, it would have healed by now, right? Like 4 weeks, it would have healed. But instead it's getting worse, and you're telling me that this taste I can taste in my mouth is impossible. But I know what I can taste. So she's like, oh, fine. And she leaves. And at this point, I'm like, I've had so much mistreatment from this hospital. I speak to the nurses and I'm like, I want to make a complaint. They give me the details for PALS, which I'm going to be making a complaint, inshallah, to them about this. And they go to me and they're like, oh, you've got to wait now to see another doctor. And that's when I call my husband and I'm like trying not to cry here, because I feel like to have a doctor sit there and tell you you're imagining it, this person that you trust to make you better when you're in pain, to say, no, you're imagining it, it's not real, it's all in your head, you're making it up, to make you feel so invalidated and to basically insinuate that you're lying and that you're wasting like NHS time. I felt horrible and I was so upset. And I called my husband because I was like, I just want to walk out, because what if the next doctor I see says the same thing and I've wasted their time? Or what if there's something wrong and they're not going to treat me? Like, what do I do? And he was like, don't worry, we'll figure it out. Just come home. Just leave that for now. We'll figure something out. And I'm like, okay. So I say to them, I'm going to sign myself out. Medical discharge, but I want it noted on the system. I'm not signing out because of against medical advice. I'm signing out because I don't trust you guys to treat me correctly. I don't trust you guys with this when this whole incident occurred because of you, because you didn't listen when I said I was going to pass out, when you didn't check up on me. So I leave, and at this point, I'm just in disbelief that a doctor can stand there and gaslight you so bad and just ignore all of the I had physical present, I had a swollen face. I wasn't imagining my face being swollen. I have photos from my face being swollen, right? So I go outside, I'm on the phone to my husband, and I'm trying not to cry my eyes out at the fact that I don't know what to do next now. Do I just ignore it and hope it gets better? What do I do? I then get another call, and I recognise the number to be from the hospital, and I'm like, whoa, what is this? And I answer the phone, and it's the very first doctor that I saw, and she turns around to me and says, where are you? I was like, what do you mean, where am I? I'm outside, I've discharged myself. She's like, why? And I explained to her the situation of how the first doctor spoke to me, of what she said to me, and she apologises. She's like, I'm so sorry, Amy, that you had that experience. That's not okay. She should not have spoken to you like that. That is completely unacceptable. I'll tell my consultant. I'll make sure that she's reported, all of this. And I'm like, okay, I don't, why have you called me? She goes, I'm really sorry. We've reviewed your scans, both me and the consultant, and we can confirm that we can see a line. I'm like, so you mean to tell me a doctor has just told me I'm imagining my symptoms, but I've fractured my jaw? I have an actual broken bone. And this doctor tried to tell me that I'm imagining it. And at that point, I just break down crying, because I'm like, that doctor is sat in that A&E room filled with patients. How many other patients is she going to gaslight into thinking there's nothing wrong with them? And what if that patient goes home and dies? What if that patient is misdiagnosed and then has a lifetime disability or something because of that treatment? That's not okay. So I'm crying my eyes out. She's like, I'm so sorry, we don't have any maxillary facial specialists here. You're going to need to go to another hospital where they can check you out and they can have a look at you, see if you need your jaw widger or surgery or anything like that. especially because at that point I couldn't open my mouth wider than like 2 fingers, like at all. It was so sore. I couldn't talk properly or anything. So I'm like, fine, okay. So I thank her and I go to the other hospital where they do confirm. On the x-ray, you can sort of see like a slight shadow, but you can't see a line or anything. And she goes, yeah, does like the whole like examination, which was really sore, by the way, like forcing my jaw to stay open like that. Oh my gosh, when I left, like I had tears in my eyes, like when I went home, because my mouth and jaw was just in so much pain. And she confirmed, like, she thinks that I had a broken bone at the back here is what had happened. She said you don't need to do like any surgery or anything for it to heal. You tend to just leave it. You like have a soft diet, if you grind your teeth, you wear like a retainer thing to stop that from happening, and it just eventually heals on its own without, you keep your jaw like nice and not tensed or whatever, and it will heal by itself. She didn't do another scan because she's like, it's not going to show up. It would show up on another scan, but it's not going to change like how you treat that break. It's still going to be the exact same treatment plan. I was like, that's fine. And then I say to her, well, what about the taste of blood in my mouth? The other doctor told me it was impossible to feel that. Like, why is it when I open my mouth too much that I can taste blood in my mouth? And she goes, oh, you're not imagining that. That's not impossible. What's happening is when you're opening your jaw, joint fluid, I think it's called synovial fluid, like joint fluid is leaking through, and you can taste it through your cheek. So to the other doctor who told me that was impossible unless you have a cut in your mouth, I appreciate that you're a general practitioner and you don't know everything about medicine, but it is possible. And I was tasting joint fluid from a broken bone in my mouth. And I can confirm it's been a few weeks now. I've been following the doctor's instructions and it has gotten so much better. The swelling is starting to go down. The pain medicine is helping. The soft diet is helping. And it is healing. But this is just your sign that I was so mistreated, not by one doctor, but by multiple, purely because they were stressed or they were busy or they just wanted to see the next patient. But I knew something was wrong. So if you ever find yourself in that situation, please, please, please just advocate for yourself. If you are adamant that there is something wrong with you, ask to see another doctor, ask to see a specialist, ask to speak to someone else, because doctors can't know everything and they make mistakes, but you know your body and you know what you're feeling. Obviously, hypochondriacs and stuff do exist, but if you're not that type of person and you know